trust if patients are willing to come forward and talk about their personal journeys? Personal journeys. With an audience like ours, we're very, very happy to be seeing two patients from OVID Clinic here, Frau Müller and Frau Walorska, and Herr Lipinski, who is one of the study patients. Just to point it out, I have been in contact as a therapist with Frau Walorska and Herr Lipinski, just to make this very clear, because it can also be a confounder in such an event like this. We are in the understanding that it's okay to be doing this together, luckily. Thank you for that trust. And what we would like to do is take the chance and hear from the inside. So not the therapist's perspective, not the scientist's perspective, but from the perspective of people who actually have come to this kind of treatment, have gone through it, and have their perspective on how it has been going, what was important, what they take away, and what may have been the difficult points. And I would like to give you three the chance first to introduce yourselves and perhaps let us know or also why you were seeking therapy, and take it from there if that's okay. Would you like to start?
Oh, okay. The first one is always the tough one. So my name is Agnieszka Walorska. I'm entrepreneur and used to live with a lot of pressure. And due to like certain events in my recent life, I will not bore you with the details. I was kind of feeling restlessness, stress, a lot of pressure for results, and actually also kind of a detachment from the feeling. So I'm like pretty much a person who lives in her head and tries to analyze everything, and the feelings come like kind of second. And actually, there was a very spontaneous decision to seek treatment. It was not that I was consciously evaluating. I haven't been in treatment before, or like for 20 years. 20 years before I have been, but for the past 20 years I haven't. And I actually expected to confront some of the traumata from my previous life, from my childhood, but the results was actually quite different.
Okay, my name is Gitti Müller, and I'm an anthropologist, but I have been working as a filmmaker and journalist the last 20, 30 years. And I'm now working as an artist, and that came parallel to my therapy. I began to paint. Yes, I have always been depressive without knowing. As a child, I was a very sad and lonely child. Then as an adolescent, I was a very sad and angry adolescent. And then as a grown-up, I was quite still sad, but very, how do you call that, fighter? Okay. And I have had several therapies, psychotherapies, and I would say each time I have learned what happens, and I have learned to analyze why that happens to me, but it never took the problem at the root. I mean, my negative thoughts and anxious anxiety, all this stuff was the same. It didn't really change. So when I heard about ketamine, this possibility, I thought, okay, I'm a little bit old now, but it's still worth to change completely. And so I will just try it and see if that helps. Yeah.
Thank you very much.
So my name is Andrea Lipinski, and I would like to...
Excuse me, could we please close the doors? We're talking with patients. It would be very nice if we hadn't got the noise disturbance like every 2 seconds. Cheers.
I don't speak English very well, and I would like to translate me.
Okay, Mr. Lipinski works as a translator and interpreter, and also and all through his life he was concerned with finding out who he is.
Und auf dem Weg, also über die Frage des Bewusstseins und die Bewusstseinskultur, bin ich darauf gestoßen, auf die Studie und daran teilgenommen.
Through thinking about cultures of consciousness, he came across the study and began to find interest in it. He had a session 18 months ago and describes this experience as life-changing and setting him on a different track, so to say.
So you were part of the psilocybin study here at Charité. Right.
I'll take the liberty to say 2 or 3 words about myself and who I am. My name is Timo Storck. I am a professor for clinical psychology and psychotherapy at Psychologische Hochschule Berlin. And we're entering a cooperation with OVID and Mind, and I help to translate, and maybe I have 1 or 2 thoughts on your experience, which I'm very impressed that you share them with us.
And I apologize for cutting you out at the beginning. So, okay, right. So if we look, so we've heard that you've had different stories arriving to therapy, and when you came to the different side of therapy, so ketamine augmented psychotherapy and psilocybin augmented psychotherapy on the trial, what were your expectations? What were the things you thought would happen, could happen? What were your hopes?
So first thing, I think the decision was not just for the ketamine. I was scared of actually going to therapy also because of maybe some not so good experience with therapists that I had before, and also some like closed-mindedness. And I was really looking for someone who is very, very open-minded. It sees like a lot of possibilities, which like the ketamine is obviously one of the indication. Like most of the therapists wouldn't touch this. Yeah, so it was for me, even if maybe the ketamine is not for me, but then at least I will face someone who will present me to all the possibilities that are open for me. And as I said in the beginning, I thought that this enhanced therapy will help me process some of the traumata from my childhood, that I would be better able to face it, and I thought that this ketamine therapy will be the way to do this. Yeah, at the end it came very differently. So I actually didn't face any of the traumata. I faced totally different things, that like very positive aspects, which probably, yeah, that was obviously my way to go. I'm not sad about this.
Well, I don't remember very well from where this idea came. Maybe it was my son, or it was a film I saw, a documentary film about drugs in general in psychotherapy. My hope was that something different happens than in normal therapies, you know, because the normal therapies, as I said, they always help me a little bit to understand better what is going on, but it didn't really change my situation. I mean, once I read a book, it's called The Monk Who Sold His Ferrari. I don't know if you know this one. And the message I took from the book was, you are the master of your thoughts. And that was a very surprising aspect for me, because I never thought that I'm the master of my thought. And I thought, yes, that's interesting. So if I'm the master of my thoughts, I just have to change my thoughts. That's easy. But it was not so easy. So I tried positive psychology, telling myself, you are lovable. And then there was a little voice saying, no, you are not. So I had always this voice which didn't allow to really believe those things. And I had the hope that with this therapy, maybe something could change more at the root. Yeah, that's the point.
Thank you.
Mr. Lipinski describes how he was for 30 years like searching for solutions because he felt like being in a deep black hole. He tried various therapies in terms of cognitive insights, but nothing really helped. And through the idea of cultures of consciousness, which is a term by Thomas Metzinger, I guess he learned from the study. And Thomas Metzinger will be talking in a panel tomorrow at noon or something. Concerning his expectations, he thought, well, what do I have to lose? It can't get worse. He's always been keen on experimenting, and at the worst, he'll dissolve. And that's actually what happens, dissolution, within or through the dosing session. That was his experience, an experience of dissolving or dissolution, which helped him to find a new track.
At this point, we've got like two diverging roads. We've got ketamine and psilocybin to talk about, and perhaps we separate it a bit up because it's difficult to stick with the same questions, because obviously there's different treatment paradigms. There's one being a trial, one being like clinical work. I would just like to stick with your experience for a moment, if that's okay. So you were saying that so just to put it out there again, so the episode study is basically a crossover design. Everybody gets gets psilocybin in high dose, 25 milligrams, so a bit higher than at Johns Hopkins usually, at least once. Some people get it twice. The others get either a placebo, being niacin, or a low dose psilocybin the second time. When you had your first dosing session, what were your takeaways from that?
He's convinced that during the first dosing session, he received the low dose. He describes this experience as kind of a space journey where he came back relieved, relaxed, and happy, and slightly different than before. Yet we didn't view that as a breakthrough yet. Mm-hmm.
And was the breakthrough something you were hoping for?
After the first session and the experience, he was looking forward to the second one. At first, he falsely assumed he had received the high dose within the first session. Six weeks later, he actually received the high dose, and that was the breakthrough. Yesterday in the German speaking panel, he described and talked about what like what was the kernel in the experience? Earlier on today, he took part in the panel on death experience and how psychedelic therapy can help to get rid of death anxieties. Within the second session, he actually felt he was dying, and that was what he experienced as a breakthrough.
I would like to come back to interpreting that a little later. So you hear that now, one session, big bang. What were your experiences with the ketamine sessions? Were they comparable? Were they different? You had 6 each? 5, and you had 7. Okay, so makes 6. Sorry, I should be counting better. That's embarrassing. Okay.
Yeah, so I think the best description of, so it was not like a big bang. I think that's a big difference. But it was a very intimate date with my own mind. I think that's the best description of all the sessions, and especially like already the first one, where I didn't feel yet like, oh, that's a huge change, but it was. I think it was the first one was just incredibly positive and relaxing, and was kind of a little escape of the everyday stress. But they differed. Like, so the 5 sessions each were very different. Most of them were. So that was actually the biggest surprise. That in almost all of the sessions, instead of facing my fears and my trauma, I was facing all the things that are positive in my life, that are amazing and worth living and something to hold on to. I think this was a very, very, very interesting. And in your introduction, you said that you started painting during the ketamine or after the ketamine sessions, and it's really interesting because I started playing the piano again, like the first time after 10 years. So my husband, with whom I'm for like 11 years, he heard me playing piano for the first time, like after my second ketamine session, which is actually quite interesting that this is causing this kind of feelings, and maybe, you know, my creative part that is actually always behind my like kind of scientific perspective on things. And I think this has a lot to do with the diversity of emotions that I started to experience and understand after the sessions, especially like, for example, when I started, all the negative emotions that I had kind of went down to be anger. And right now I see that there's like a huge scale of very, very different emotions that I'm very well, maybe not, but much better able to separate from each other, to understand and to process and to feel.
Yeah, interesting. Well, my first session was full of fear. I had so much fear. I was so insecure. I didn't know what will happen now. And alone the fact that there was an infusion, you know, I didn't like that very much. And I was very pleased that there is always an anesthetist and a Notfallmediziner. I don't know how you say that. Emergency doctor. So I knew that will happen because I'm kind of anxious, and we always prepare the session with an intention, and my intention was to trust, but that didn't work out in the first session at all. So, you know, you can't see anything, and you have headphones on and hear music, but I was I think, asking like every 10 minutes, Herr Müller, are you still there? Herr Müller, are you still there? That's my therapist. And he answered, oh, yes, I'm here. Yes, I'm here. So it cost me quite, it was the whole first session, I think, I spent to try to trust and to release. The second session was much better, so it was really like a success, and I could pretty much chill. How do you say? Relax. So that was very nice because I saw a lot of colors and I was like kind of flying, and I was remembering a very nice trip in Honduras where I went to snorkel, and it was the same kind of feeling, like I'm part of this magic, you know. And I experienced the same thing in the second session. So I was very surprised. And I was very surprised that sometimes there came thoughts, but crystal clear. I mean, I was like, it is, you nearly sleep, yeah? But the thoughts are so clear and so like you see it written. And it were a bit similar. It were very positive thoughts, you know, and I'm not used to have very positive thoughts. So, and this time I believed them all. I mean, I didn't question them. It was clearly yes, a yes. It was a fully yes from my part. So that was quite impressive. And in the next sessions, I always had an intention, and it's a lot of work. I mean, it's not just to lie down and to get your ketamine. It was a lot of work preparing and after that integrating. But I learned a lot about me and a lot of feelings. That's right. To distinguish, there are different feelings. It's not just sadness and anger. There are a lot more, and there are positive feelings. I mean, imagine the only positive feelings I had until then, so like 60 years, were when my son was born, and the other one, when my son was born. Really happiness and joy. But that was the only moment. Yeah, and now I was learning, and in the session I felt joy. I mean, I think it was the third or the fourth. I really felt a joy, a pure joy. It was so incredible.
So from what I'm grasping from what you three are telling me is that those experiences were meaningful on different layers, like letting go of the fear of death, learning about positive things in your life, experiencing joy, letting go of difficult emotions to make space for other, more diverse emotions, also understanding perhaps better processes in your life that had been going on. So how did you manage to translate that into something that was useful for your life? So that went beyond just that session? Or was it a no-brainer and just happened?
Mr. Lipinski says that the process of integration started during the sessions, but is still an ongoing process and will probably go on some more. And now, a year and a half after the sessions, the process seems to him to be even more important than he thought right after the sessions. Because the longer the sessions lay in the past, the more different areas of his life are affected by it. That leads to a paradox situation where on the one hand he senses and feels the change. And at the same time, living according to that would mean changing other features, outer features in his life and like social interaction. And he sees that as the greatest and most important challenge a year and a half after the sessions, like to, if I'm allowed to say that, to kind of reorganize your life.
Thank you.
I wanted to ask the three of you something, because I'm impressed what you describe. And I think throughout the conference, there's one question from a psychological, scientific point of view. If psychedelics change states, which they obviously do, you describe different feelings, so, but do they also change traits, like personality features or creativity, thinking about the endless, the finiteness of life? And I wanted to ask you if, like, I have the image that psychedelics, they don't change traits, they don't change personality features, but they help you to change personality traits yourself, like being the master of your own thoughts or having access to creative parts or thinking in a different way about death. Would you agree that the psychedelics don't change your personality features, but help you to change yourself?
I'm pretty positive that I wouldn't consider it changing personality traits, but actually helping discover aspects of your personality that were consciously or unconsciously hidden or like, you know, put aside or put back, and get access to actually more of it. So like broadening your spectrum of emotions, feeling, maybe also like personality traits, whatever it would be. Yeah, but also maybe on the integration and, you know, the part, I think it helps also change behaviors. Yeah, I mean, it's not immediately changing your behaviors, but by giving you this insight and this access, it makes you think differently about how you act in some kind of situations, which obviously is, I mean, it's very hard to change behaviors that you establish for like 30, 40, 50 years or even for 10 years. And this is kind of the impulse that really helped me reflect on some kind of behaviors, for example. So I would not say changes personality, but yeah, gives you more access, and by this gives you also more access and opportunities to changing some of the behaviors.
Yeah, I think the same, and I would say also it helps you to be more authentic. You know, you find your more authentic self, and to live this authentic self. I think that is a big success.
Mr. Lipinski agrees? For him, the change has to do with having viewed himself from an outer perspective? So that he viewed himself in a more objective way and had an idea of his true self. At the same time, that outside perspective kind of became something internal and changed the view he had on himself. To him, viewing himself has become more objective and allowed him to be more laid back with himself. As a result, he can and so that he can also act in accordance with his true self and find more strength.
So your therapy was last year. You two have been treated mostly this year. If you look back at this treatment and what you've come to, do you think with standard talking therapy you would have come to that point? And if so, how many sessions do you think you would have needed?
I wouldn't probably have done it. I'm not sure. I would probably, I mean, I know myself, so I would probably get annoyed after 3 and then say, okay, whatever, I'm not doing this anymore.
I'm sure I would not have got to the same result, because I have done other therapies before, and as I said, it was just it was good to understand better what is happening to me, but it was not a solution. So I think at this level, I could only do that with that therapy.
Mr. Lipinski describes how 20 years ago he suffered a major crisis and since then had tried with psychotherapy to change something, including 300 sessions of psychoanalysis. And all of that didn't help him like the few sessions did.
Wow. It's interesting to hear also for us, because we're working with those substances as therapists. We are like on new ground. There's so many things still to learn, so many things where we are not quite sure if what we are doing will really be the right thing. And actually, it's very just the feedback, very touching for me also to hear that this works for you, and that you are really benefiting. It's not a fleeting moment and it's gone, but there has been long-term effects. And we've heard that from other patients as well in the German panel yesterday. And sometimes it wasn't all that easy. It just took a little more time to understand and then see later on, oh, wow, this really changed something. At this point, we have like another 10 minutes. Would you be willing to take, only if you want, 1 or 2 questions from the audience? Would that be okay? And always be reminded you only have to answer what you want to answer. Would there be questions from the audience? Where's the 4th microphone?
Ich kann meins bringen.
Okay.
My question would essentially just be the same question you just had. Why was it that the few sessions were helping like that when 300 sessions didn't?
Mr. Lipinski says that that's basically one of the most important questions that is being dealt with scientifically in research. He acknowledges that that was not for nothing, the sessions of psychotherapy before. Probably the psychotherapy before played a role in benefiting from the dosing sessions. And And in he refers to that documentary on Arte TV, where Andrea Jungaberle referred to. I think it's a metaphor by Michael Pollan with like the snowball, where something
Been around for 30 years,
okay.
that metaphor.
And Mr. Lipinski says that that image describes his experience pretty well. Something is like reorganized. In the brain, there is, something is reorganized and in the brain set together in a new way.
Hi, first of all, I just want to say thank you so much for coming and like telling your story. It's amazing to listen to you guys, and it's a perspective that we need to always keep in mind, because of course the patients are the most important. But I would like to ask about like the therapist's role in your sessions, and how much impact did you get, or did you need impact from the therapist? Like, what was the role basically in your sessions?
I can start answering this, as my therapist is sitting here as well, so which is also a pretty little strange situation. But I think that the therapist plays a big role in like creating the correct like set and setting. I mean I wouldn't do this like kind of on my own with someone who is doesn't know what to do, and the right therapist in the session not only kind of prepares you for this, but also for me the importance of the safety element. There is someone, I knew that nothing negative at the end is going to happen, although obviously when you're deep in the experience you get lost, you lose the touch with the reality a little bit. But there is some subconscious knowledge for me that there is someone who will help me out. And also, obviously, in the integration, that's absolutely necessary that there is someone who guides you through this experience. And I think it's really important that's the right person, because otherwise you kind of you get all the influence. For example, before the session, if you have the impression that it's something is not right, maybe in the relationship with the person who is in the room, it might also affect your experience. So I think that's quite of a crucial relationship, in my opinion, or in the experience that I did.
Yeah, I think I never could do that without my therapist, and he has a very big role in all that. And I did more sessions also, psychotherapy, because I wanted to resolve some traumata from my childhood, and they didn't came up in the sessions. That's very surprising, yeah. And so I booked more sessions in psychotherapy, and that was very important for me. Yeah, I know there are clinics you just can come and get your ketamine, and but that's impossible for me. Yeah. I never would do that.
Thank you very much for your openness and for everything you're sharing. My question would be, if you had a friend or someone you know who's suffering from depression, if you would recommend to them to try this, and try this maybe as the first thing, or maybe you would say, yeah, try therapy, and if that doesn't work, try this. Like, what are your thoughts on recommending it to other people?
I definitely would recommend it. I don't know if it is a good thing for everybody. I really don't know. For me, it was. And I think it would be good to have done a normal therapy first, because I think it helps you to get the most benefit of this therapy, because you get to know yourself, you get to know what are the problems, and you are better prepared, I think, for this therapies. So I would recommend to do a normal therapy and then to do this therapy. But most people I know, because I'm a little more agey, most people I know, they are already done therapy. So yes, definitely I would recommend to do that, to try that.
I would like to hand the last question to the online audience.
Yeah, thank you so much. And there's one question coming about the role of the people and culture around you, so the society plays in integrating these experiences.
Mr. Lipinski describes this as a huge challenge to describe to his surrounding and other people the importance of his experience. He was aware of that before he had his sessions, but after that he's even more convinced that that should be included in treatment and in research, how to be on someone's side to communicate with his social surroundings.
Maybe like one remark to this, like also on like a societal level, what was annoying for me for the past 2 weeks is like, for example, repeating articles of about Elon Musk and his strange behavior being related to ketamine use, and I think this kind of outburst and this kind of coverage doesn't really help because it's a very prominent figure, and then everything we're doing is then being met with some kind of skepticism. It's like, oh, you do ketamine? Is it not this this drug that makes Elon Musk act so strangely? I think, and this is maybe also one of the reasons why I'm here and why I'm discussing this, is because I think we need more openness, and especially like, you know, in some areas where, or in some jobs where it's really still a taboo to discuss mental health, and then mental health connected with psychedelics. Oh, that's really terrible. Yeah.
Yeah, I had as a support, I had my son who is very open to that. But I had also a conversation, for example, with my Hausarzt, with my doctor, and she was terrified when she heard that. And a neighbor of mine, he is French, I told him, and he was very surprised. He is about 30 years old. And then he went to holidays to his home. His father is doctor, and he told me after, he told about that. And his father was just like, oh, these Germans are so crazy. How can they do that? So it's a little bit tricky to speak about it, but I agree completely, and I do it because what do I have to lose? I mean, I can just talk about it because I'm convinced it is a good thing.
So thank you three very much. Thank you very much for having us have a look at the inside of those processes, also have us promote openness and understanding, and I wish you a beautiful day.